cruising at 35,000 feet exposes airline crew to an invisible, lethal hazard from deep space. A massive study examining more than 12 million death certificates reveals that flight attendants and pilots face the highest risk of dying from radiation-linked cancers among all occupations. Watch our next report.
The cabin looks safe. The sky outside looks empty. But thousands of kilometers above Earth, high-energy particles from space are passing through the aircraft. Every passenger gets some exposure. Aircrew gets much more. A new study analyzed more than 12 million US death certificates. The study, published by JAMA Internal Medicine, shows that flight attendants had the highest proportion of deaths from cancers associated with radiation, while pilots ranked second. Researchers found about 6.9% of deaths among flight attendants and 6.7% among pilots were from these cancers, compared with about 5% were among the broader working population. Well, that is a striking difference, but there is an important warning. The study does not prove that cosmic radiation caused those deaths. Researchers could not measure the radiation dose received by each individual. Other factors could also play a role, including disrupted sleep patterns and repeated travel across time zones. So what exactly happens at 30,000 feet? Well, Earth's atmosphere normally shields us from much of the radiation coming from space. Aircraft fly above a large part of that protection. The higher the aircraft flies, the greater the exposure. Flights at high latitudes and near the poles can also produce higher doses. For an ordinary passenger, however, the risk remains very small. Experts say radiation from air travel is low and unlikely to affect health. But the situation is different for someone flying thousands of hours. Pilots and cabin crew can accumulate radiation exposure repeatedly over years, and that is why scientists are paying closer attention to aircrew. The American Public Health Agency, CDC, says aircrew may be more likely to develop certain cancers, including skin cancer, while female aircrew may have a higher risk of breast cancer, and the risk is not limited to radiation. Long working hours, jet lag, and disrupted body clocks may also affect health. So for passengers, there is no reason to panic about your next flight. For people who spend their careers in the sky, however, the question is much bigger. The invisible environment at 30,000 feet may be part of the occupational risk they carry every day.